Bismillahirrahmanirrahim. Assalamu alaikum, everyone. My name is Simreen Fatma, and I'm associated with IMI International Academic Council as Academic Coordinator. Today, I have my co-host, Dr. Kiran Ijaz, in this session. She is from US and has been associated with IMI International Academic Council for past 8 years. Welcome, Dr. Kiran.
Assalamu alaikum.
Walaikum assalam. It has been a tradition of IMI International Academic Council to hold sessions on different health-related topics. This session is one of the continuation of the series. Today, we have medical experts with more than a decade of experience with IMI's Arbaeen medical mission to discuss on the topic of Arbaeen and your health. This session is important for those who are going to Karbala for Arbaeen and want to know how to stay healthy during this holy journey. So today, our first speaker is Dr. Jafar Sayed, who is associated with McMaster University as Associate Professor at the Department of Medicine. He is also Chief of Cardiology and Medical Director of the Cardiac Program at Waterloo Regional Health Network of Canada. Our following speaker will be Dr. Mehdi Rizvi, who has his expertise in disaster management for years. Dr. Mehdi had been associated with Johns Hopkins Health System and Crowley Trauma Center and was a lecturer at Johns Hopkins too. Currently, he is associated with Imamia Medics International as Disaster Management Advisor. Welcome to both the speakers. Over to you.
Assalamu alaikum, everybody. It's a pleasure to be with you today, and inshallah, you're all blessed with the ziyarah of Abdullah al-Hussein alayhi salam, inshallah. The topic of our webinar today is really to discuss common health considerations surrounding the Arbaeen ziyarah. The objectives of our talk are as follows. We're going to review the summer climate of southern Iraq during Arbaeen this year, and a rough discussion of the geography of the Arbaeen walk. We're going to talk a little bit about the most common situation-specific health issues in Arbaeen, and also understand the spectrum of heat-related illnesses. We're going to talk about the importance of hydration, and we'll go over a bit of a checklist of what to bring and how to pack for Arbaeen, and specifically also for the walk. And then there will be an important discussion on the impact of the Arbaeen conditions on chronic health conditions, things such as heart disease, lung disease, diabetes, etc. And finally, we'll close up with a bit of a discussion on the understanding of what kinds of health services are available to you in Iraq, both along the way to Karbala as well as within Karbala. I'll turn it over to Mehdi for the next slide.
Wonderful. Assalamu alaikum. Next slide, please. Oh, there we go. Well, as Dr. Jaffer said, welcome. What an honor it is for those of you and for us to be invited to this incredible and truly a unique journey to walk with our hearts to Hussein Abu Abdullah, to raise ourselves spiritually. As we raise ourselves spiritually, we want to be careful and make sure that we're also keeping ourselves physically fit. Because remember, if you can take care of yourself physically, inshallah, you can increase yourself spiritually. As it says in our hadith, qalb salim in jism salim. All right, so let's begin with the context a little bit. Well, guess what, folks? It's going to be hot there. And I mean very, very hot. The kind of hot that's going to probably make most areas of the US, including Arizona, look like, a spring vacation. So really, without exaggeration, make sure that you are prepared for this. Remember, at the end of the day, Iraq is a war-torn country. It is recently coming into its restructuring, rebuilding phase. So a lot of the simple facilities that we take for granted in the US, even if you live in the hot areas like Houston, the facilities, the structures are still being developed and severely challenged every moment in Iraq. So They have air conditioning, but not always. They have fans, but not always. They have electricity, but not always. What that means is you have to be self-reliant. And remember that if you can take care of yourself, then you can take care of others. So keep that in mind as you're going forward. Do the basics. Make sure you bring sunscreen. Make sure you bring electric fans if you have any. Make sure you bring cooling creams if you can get your hands on those. Make sure you can get some cooling towels. All this little bit of effort goes a long way. Next. So everything that we have listed here, really the two biggest factors, if you're looking at the probability of what can harm you in terms of external factors, is going to be heat and you not drinking enough water. Now, let's start off with the obvious question. It's going to be hot. Why wouldn't you be drinking enough water? Well, the answer is simple. When you're walking, you're emotionally invested. Your thirst centers in your brain have not adapted. So therefore, oftentimes you will not feel thirst soon enough. You'll have to discipline yourself that you're consistently and regularly drinking water. Set a timer on your phone, on your watch, what have you, to make sure that you're constantly reminding yourself to drink water. Also, let's be very frank. As clean and amazing as the bathroom facilities are, considering that we have the largest gathering in the world, sometimes these places do get dirty. It's understandable. When they do get dirty, people don't feel comfortable going to the bathrooms, which is, again, understandable. What is dangerous, however, and we often see the cases of this, where people will avoid drinking water to go to so that they don't have to go to the bathroom. That becomes very, very dangerous. Remember, as much discomfort that you may face going to a bathroom that is slightly dirty, you'll face a lot more discomfort and pain and potentially harm yourself in a great deal if you don't drink water. So please remind yourself, be disciplined, drink and hydrate yourself consistently. Now, heat. When we look at physiological or external stressors in general to the body, we have a few. We have cold, we have heat, we have physical exercise. Sometimes we have, mental stressors. One of the most dangerous ones, arguably, out of all the ones I listed is heat. Heat it goes from quote unquote 0 to 60 very quickly. You're much sooner and the harm that you can get from heat can happen much sooner and in a much more severe way. So what that means is protect yourself from heat. How? Walk at night. If you see some groups and some people, our emotions are at our peak, and they're walking during the daytime, but you're feeling uncomfortable, you feel like it's getting a little too much, it's totally fine. Take a break, catch up on some sleep, get some rest, and then once the sun goes down, join the rest of the crowd to walk at night. What else? During the daytime, if you are walking if you have to walk, make sure you cover yourself up. Find some hat, find some cloth. For women, obviously they have a hijab. For men, find some scarves or something you can put at the back of your neck. Remember, every little bit helps. Find shade, get yourself rest. Make sure that you are in tune with your body to detect the warning signs earlier rather than later. And then, of course, the obvious, if you know that you have, health conditions keep an eye on those. Make sure you're up to date with your vaccinations, whether it's getting your annual flu vaccine or COVID vaccine. Believe me, you'll be a lot more you'll be a lot more comfortable, and you will be able to pursue your spiritual heights more if you come prepared, fully vaccinated, and you're not getting distracted by these ailments. And I'm not saying this is a bad thing. Of course, through every trial, you will be able to get yourself spiritually up, but be careful. All right, next. All right, when we talk about heat, this gives you a good overview of the early signs of detection to when the alarm bells really go off and you start to get to the point of irreversible injury. Heat stroke is a common term thrown around. You don't want to get to the point of heat stroke. That's when you get hospitalized and you start to really hurt your organs. One key sites to look out for is when you start to feel a little bit dizzy, when you feel cramps coming on, rashes coming on. That's a telltale sign that you're progressing in a dangerous direction. Make sure you start drinking water. Make sure you get near cooling fans. They're mist fans. If you can find some cold water or some ice, put it around your neck area, under your armpits to cool yourself down. Very, very important. Next. All right, next. Make sure you're consistently drinking water. If you can bring some ORS, hydrating salts, they do wonders in restoring your electrolyte balance, so that as you're sweating out the electrolytes, as you're sweating out water, they can give you nice, healthy balance so you can recuperate and continue your journey. Next. Again, this is just a warning. You don't want to get to this stage. This is what can happen. Heat stroke can happen if you're not careful. If you are not caring for yourself, you cannot care for others. So care for yourself so that you can serve others as well along your journey. Next. All right, Dr. Jaffer, back to you.
All right, thanks, Mehdi. Certainly, as Mehdi mentioned, hydration is truly one of the most key things that we need to focus on when we're exposing our bodies to these very extreme environments. And to talk a little bit about the concepts that underpin fluid and electrolyte balance, I think it bears a little bit of discussion. And I apologize if things kind of get a little bit technical. But first of all, you know that the human body is about 60% water. And of that 60% water, so if you take a 70 kilogram person, that's 42 kilograms of water. Of that, two-thirds is what we call intracellular fluid, and one-third is extracellular fluid. And of that extracellular fluid, you can imagine that some of that is the blood vessels and some of that is the tissues. So of the extracellular fluid, if it's 14 kilograms of extracellular fluid, then about a quarter of that is the blood vessels or the blood volume, which is also called plasma. So that basically works out for the average human being to be about 4 liters, maybe 5 liters of circulating fluid volume in your blood vessels. That's not a lot. And so when you're exposed to extreme heat environments, you could lose through your skin quite a lot of both water and electrolytes. We talk a lot about water, but we cannot also underemphasize the importance of electrolytes, mainly sodium and potassium. So the most common causes or the common sources of loss would be things like sweating. But if on top of that you're exposed to an illness causing diarrhea or vomiting, you're going to lose a lot of both water and electrolytes with that. So when we talk about fluid loss, the two sort of broad, most common ways of thinking about it would be isotonic fluid losses or hypertonic fluid losses. What do I mean by that? Well, isotonic fluid losses basically means fluid that you lose that has the same concentration of water and electrolytes to what's in that plasma volume. So we know that the plasma volume is about 4 liters, and that has sodium, potassium, and water in it. And what you're losing in your losses is basically of the same concentration to what's inside your blood vessels. And why is that important is because the brain has a couple of sensors, one of which is called a osmoreceptor, and the other is called a baroreceptor. An osmoreceptor basically is like a concentration measurement system that basically measures the concentration of sodium in your bloodstream. And once the concentration of sodium rises beyond a certain value, the brain tells you that you're thirsty. And so a normal sodium concentration in the blood is about 140, 135 to 140. So if you get up to about 145, that means you've lost water. And that will trigger a sense of thirst. And then you're going to immediately go and grab that huge bottle of water and start drinking it. And within about half an hour, you'll start to feel better. But isotonic fluid losses, which is the most common cause of loss in these hot settings, you can lose a lot of fluid and not trigger that receptor, the osmoreceptor, because what you lost is exactly the same concentration of what's in your blood. So you could potentially lose a liter, 2 liters before you have the other more extreme sensor get triggered, which is the baroreceptor. And the baroreceptor is basically a pressure sensor. And once you've lost so much volume that your blood pressure starts to go down, then the baroreceptors get triggered, and you also will start to feel dizzy, perhaps, or even have a fainting spell. And when the baroreceptors get triggered, that is also a trigger for thirst or a trigger to make you want to drink. So the point here is that in these hot environments, you can lose a lot of isotonic, you can have a lot of isotonic loss before you're even aware of it. And it's not to be underestimated. Can we go to the next slide? So how do you stay hydrated in such environments? Well, being aware of these basic facts is key. And you really want to watch for the symptoms and signs that Mehdi was mentioning, and try to stay ahead of the curve with your own bottle of water and ORS tablets or powder, and fairly religiously throughout the day, hydrate yourself up with a liter at a time. It may sound like a lot to drink a liter, but it may surprise you to know that in extremely hot environments, you can lose up to 3 to 4 liters in the span of a few hours, and even up to 10 liters a day if you're actively sweating. So it's incredibly important to know that you are facing, you're in an environment where you could have that rate of loss, and you need to not only just keep up with it, but potentially catch up with any deficits that you may have. And I would say that one of the most easy ways of knowing whether you're staying ahead of the curve is your urine output. I think maybe had a slide there where he showed the color of the urine. And I know it sounds kind of crude, but it's a very useful way of self-monitoring your status. So number one, if you haven't felt the need to go to pass urine and it's been hours, then that's a warning sign. And number two, when you do go and you find that your urine is very, very dark colored, that's confirming for you that you're in a very volume contracted state. You're down in terms of water, as well as you're probably down in terms of sodium and potassium, and you need to take immediate corrective action to reverse that. And you have to realize that when you're in that state, you're in a state of deficit. And so there's this deficit that you have to overcome, and you then also have to get back to a maintenance rate of consumption that will prevent you from getting into a future deficit. Okay, next slide. Okay, so switching gears a little bit towards infections. As you can imagine, the most common types of infections you may face in an environment such as this would be gastrointestinal infections as well as respiratory infections. So, touching base a little bit about gastro, of course, everybody knows the general precautions would be to avoid contaminated food and water. Obviously, easier said than done when you're in a place where there's, 21 million pilgrims. But to the extent possible, you want to, make healthy choices in terms of making sure that the food you're consuming is fresh. I would say, Alhamdulillah, for the number of people that attend Arbaeen, the percentage of GI illnesses that we see is a tiny, tiny, tiny fraction of what could be. And I think that's a testament to generally the very, very good hygiene that exists within the mawakib, where people prepare the food. It's generally very fresh and everybody has, clean hands. But despite that, obviously some events do occur. And again, when it happens, it's due to contaminated food, typically due to bacteria such as E. coli, which produces a toxin. But it could also be other nasty bacteria such as salmonella, which can cause typhoid fever. And in fact, Iraq is endemic for typhoid, so you want to be cognizant of that, and we'll talk a little bit about how to prevent typhoid. Viruses are, of course, super common, and of course, as are parasites. With regard to typhoid, I know we're getting a little bit kind of late for this in terms of preparation for Arbaeen, but there are some vaccines that you can take, either an oral vaccine that comes in the form of a powder or a injectable vaccine. And you have to, if you're going to take the oral vaccine, which is the more common of the two, you have to actually start taking this as 4 capsules every other day, and to finish that at least 1 week prior to your departure. So there still is time if you really wanted to do it, but you would need to get on it to get to your primary care provider and get them to prescribe you the vaccine for typhoid. Even when you take it, though, it's not 100% effective. It has about a 60 to 70% effectiveness rate at preventing typhoid. Next slide. Respiratory illnesses, I won't like touch too much upon. I think people all know that you can, of course, get the flu or pneumonia. And up until a few years ago, the dreaded COVID-19 was on everybody's mind. And of course, there is definitely going to be that risk of exposure to respiratory pathogens. Most commonly, if it is going to be a respiratory illness, it will most likely be viral. And although people talk a lot about COVID, the actual percentage contribution of COVID compared with other common respiratory viruses is actually now quite small. Okay, switching gears a bit to talk a little bit about perhaps the most common health conditions. Type 2 diabetes is a big one. It's probably about 6 to 8% of the North American population are type 2 diabetics. And people often sort of wonder what's going to happen to my diabetes when I go on a trip like this. Well, number one, people have this misconception that their sugars are going to go down when they're under stress. But in fact, the exact opposite happens. So when you're in a state of stress, your body activates certain hormones to overproduce sugar, and so your blood sugars tend to rise, and therefore your drug requirements, or if you're on insulin, those requirements would actually go up, not down. The second thing that happens paradoxically is that when you're in a state of ziyara, there is plenty of food around, and people actually tend to overeat, not undereat. And not only are they overeating, but they're eating richer foods than they might be eating at home. And that actually is another direct reason why the sugars tend to go up, not down. And why is the blood sugar super important? Well, it's because sugar is an osmol. It's a molecule in your bloodstream that normally the body is perfect at regulating, but when you're diabetic, the sugars go way up. And when that concentration of sugar goes way up in the bloodstream, it actually acts like a diuretic. It makes you um, pee out that sugar, and alongside that goes a lot of water and sodium with it. So it ends up being what's called an osmotic diuretic. And that's super harmful if you're already in an environment that is very hot, and you're already having excess losses off of your skin. So if you are a diabetic, you ought to be very excruciatingly cognizant of your hydration status and your sugar status. So if you're diabetic, you should definitely be bringing your glucometer with you, and you should increase the frequency of your AccuChecks or your self-monitored sugar checks to maybe 3 or 4 times a day, so that you have a really good sense of what your sugars are doing. And if they're running higher, then you need to rapidly up titrate your drug dosing. Or if you're on insulin and you have an ability to kind of increase your insulin dose, then you should definitely be doing that. There are some newer medications that people use for diabetes. They're very common now. They're called the SGLT2 inhibitors. And these, if you're on one of these drugs, they also have a bit of a diuretic effect, meaning that you lose sodium and water when you're on these drugs. They're probably okay to stay on when you're on Ziara, but you want to then again be very aggressive at hydrating yourself up with both electrolytes and water. Drugs like insulin and Ozempic need to be refrigerated, and that can certainly be a problem in the Iraq environment. But as you may know, insulin that has not been used yet definitely has to be refrigerated. And Ozempic as well, when it comes in the pen, it has to be refrigerated or kept very cool. But once you've opened the insulin or the Ozempic, you can actually let it be at room temperature for up to, I think for insulin, it's at least a month. And Ozempic, it's a little bit longer than that. But we're not even talking room temperature when we're in Iraq. We're talking temperatures of 40 or 50 Celsius. And so in that situation, these drugs would rapidly degrade. And so if you are on those drugs, then you really should think about bringing a little portable travel cooler. And I was just looking out there on what's on Amazon, for example, and you can actually buy these dedicated portable little coolers. They look like coffee travelers, but they're actually built-in coolers, and they can house your insulin as well as your Ozempic pens and whatnot. And actually, some of these are actually TSA certified for travel, so it's worth looking at that if you are on those medications. In terms of heart disease, well, again, super common. Um, Heart disease is a broad topic, but I would say that the most common consideration is people with coronary artery disease who've had a prior heart attack and have had maybe either bypass surgery or stenting. Um, the rule of thumb that I would have, especially as a cardiologist, would be to say that if you have really good control of your symptoms, or if you don't really have any angina, and your recent stress testing or cardiac tests were unremarkable, and your cardiologist perhaps has also reviewed you, then I think that you're fine to, embark on this trip. But again, you have to be very diligent about, taking your medications on time, and also pacing yourself, and be very aware of your own symptoms. Specifically, if you do happen to have angina, and we have a grading scale for angina, 0 all the way to 4. If you have anything more than mild angina, which would be class 2 angina or more, then it would not really be very advisable to push yourself very hard in these conditions. You would either want to consider, curtailing your walk, or not doing it at all if you have an advanced burden of angina. If you're on drugs that are what are called diuretics, these are drugs that are designed to actually lower your blood pressure by making you lose sodium and water, That's exactly what you don't want to be doing when you're in Iraq. So you would probably, you would need medical advice specific to your condition, but you would probably be either holding those diuretics or cutting those doses down dramatically. There are also some specialized cardiac drugs that people are on these days, and I think there are individual things that can be, recommendations made. And I'm happy to, speak offline about some of those if you have any specific questions. Next slide. Okay, so the Arbaeen walk itself, obviously there are many on this call that have done it already, but it's about a 80-kilometer distance from Haram to Haram, and I believe 70 kilometers from pole to pole. And each pole is 50 meters apart, and there's 1452 of them. And there are a lot of guides out there now that I'm sure people have seen on Instagram or Facebook or other social media that give people a good guideline of what services are available along the walk. It's a tremendous experience, of course. I've had the privilege of doing it once. And you can see that there are some incredible services along the way. I've just put a little graphic of what was published a couple of years ago showing the various mawaqib of Indian or Pakistani or Western affiliations. And many of these are well known, and some of them in particular have fantastic facilities for rest, food and drink, as well as Western toilets, and are a great place to target in terms of you doing the walk. Typically, I mean, I think when people are doing the walk these days, because of the peak summer months, most people are doing the walk starting in the evenings and they go until about, 9 or 10 in the morning, and then they'll check themselves into a mokib. You also have to be a little conservative on that because you don't want to push yourself so far into the daytime that A, you're more dehydrated and tired, and B, when you find a mokib that you want to be checking into, that there's actually no space there because you arrived a bit too late. So that's something that you do want to consider. Next slide. I think I'll turn it over to Mehdi.
All right, great. Thank you, Dr. Jaffer. I actually really enjoyed that. That was a great, balance. I think everybody took a little something away from that, presentation of yours. There was some pathophys there. There was some simple guidelines. It's great. All right, folks, how to pack. Medications. I can't emphasize this enough. If you are going to be going to Iraq, make sure you set several reminders for yourself to carry medications and enough medications for the duration of the trip. Not only that, please do me a favor today, if you can. Really, today, if you can, take your phone and take a quick picture of the medications that you have, all the medications. You don't even have to write down the names, the dosage. That take a picture and keep it to yourself and send those pictures to somebody you trust. Because if something happens, if you lose your medications, you come into the medical camps or you see a physician, we can help you get the medications you need in Iraq. But we need to know what medications you were on before. Very important. Food and drink. There is clean food, good food on the route. You don't have to worry about it too much. Of course, if you have very, very specific, items you need, for example, we were talking about diabetes. If you got some glucose tablets that you feel like you may kind of need, you can pack those. But ORS packets, sure, you can bring those. But if you need your Desi chai fix, as Dr. Jaffer said, there are maps, routes that are famous for that. You can get it. Don't worry about it. Pack light, pack efficiently, pack effectively. Dress, yes, you do have to wear black, but You also got to be making sure you take care of yourself. What that means is if you got to use a white hat, you can use a white hat. It's fine. Make sure your clothes are breathable, they're airy. For women, I know you have to dress up in layers, but that doesn't mean that you have to dress up in tight layers. Have some loose clothing so that you can have your air circulation going. For men, remember, just because you don't wear hijab doesn't mean you cannot cover your nape. So make sure you cover yourself at the top. Small actions like this go a long way. Footwear, try your sneakers on, make sure they fit before going. You don't want to cause major injuries in your foot from friction from friction and lack of fitting. Go to a good store, get good fitting shoes. Now is not the time to be cool. You don't always have to go for the Nikes. You're fine with getting your New Balances. As long as they're comfortable, they're good for the walk, please make sure you prioritize that. Um, uh, to avoid friction, a, an interesting little tidbit that I found to be interesting recently myself. I learned this, and that is petroleum jelly helps out between, especially in the spots where you're sweating. It helps reduce the friction, especially in some areas. Again, what has been emphasized by Dr. Jaffer in the past, as well as you don't have to lather this on, just use a little bit to create a slight barrier between the areas that cause massive friction, whether it's your groin areas or your toes or your feet, and so on and so forth. So pack effectively, efficiently, and light. Thank you. Oh, of course, keep pictures of your passports on your phones as well. Of course, you'll be carrying it. In Iraq, you cannot travel without your passport anywhere. And I mean from point A to point B, from Najaf to Karbala, from Karbala to Samara, and so on and so forth. You always need your passport. God forbid something happens to it. Make sure you keep a picture of your passport and all your documents on your phone. Again, share with somebody else as well, your companions in travel, so that if something happens to your phone, you have a backup. Iraq is a war-torn country. Let's emphasize that again. The structures are coming back. They've done a fantastic job. They're rebuilding, but you always want to have a backup to the backup to the backup. Next. Dr. Jaffer, is this you? I believe it is. Dr.
Right, sorry
Jaffer, I
about that.
believe this
Yeah,
is
sorry.
pivoting back to you.
Yeah, thank you. Pivoting back to me. So we're going back to kind of like, that we talked a little bit already about diabetes, heart disease, and the general considerations in, the Iraq environment. But specific to the walk, again, same things, not to belabor the point, but if you're a type 2 diabetic, you want to definitely ramp up your glucose monitoring frequency. Don't fast during the walk unless it's medically, supervised. The most common diabetic are what we call the type 2 diabetics. And these are the people, as I mentioned, whose sugars tend to run high. And you almost never suffer from what we call hypoglycemia or low sugars. So that's a myth that has to be busted. So your biggest danger if you're a type 2 diabetic is that your sugars are too high and they're causing you to lose water and electrolytes every time you urinate. The type 1 diabetics, only 10% of diabetics or less are type 1. These are the people who have been requiring insulin since the time that they were diagnosed with diabetes. And this is the diabetes where there's an actual lack of insulin being produced in your body. So these are the folks that can end up becoming hypoglycemic if they didn't eat, yet they took their insulin. And so those are the people that actually need sugar tablets in order to, raise up their sugars or, to rapidly raise their sugar through, drinking juice and whatnot. So again, what I have to say about diabetes mostly is that the type 2 diabetics, the most common, you just need to be very diligent about trying to maintain as close to normal a blood glucose as you can. And that is through just, very ramped up surveillance of your sugars and hydration to keep attention to your urine output. Heart disease, again, walk slowly, avoid stairs, unnecessary sudden exertion, take more frequent breaks. And again, if you're on drugs that, cause you to lose sodium and electrolytes, then you really need to consult your specialist before your departure, to see, what sort of percentage ramp down you might need to do for certain medications before you enter that environment. There is obviously some air pollution in Iraq. Generally, it's not so much a polluted environment, but it's just a very hot and dusty environment, and that can sometimes trigger uh, people's asthma or their COPD or emphysema. And if you're that type where your lungs are sensitive to that, then you may want to wear a mask. This may be a situation where you would want to wear an N95 mask, for example, in particularly dusty areas, to prevent those particles from inflaming your lungs. The air quality is definitely better at night, and it's cooler, of course, so it's better for your lungs as well. And if you are on inhaled corticosteroid drugs, those are absolutely key, because these are the drugs that actually reduce the inflammation in your lungs. And if you are on those, then you need to pack those and make sure you take those diligently, twice a day, as they're prescribed. Next slide. Okay, I think this is back to you, Mehdi.
All right, so the services we have available from the healthcare perspective now, focusing on that during the walk. There are several mawakibs that you will see that are affiliated with the various organizations that are there. One thing I would advise folks is uh, if you are getting access to medications, make sure the access that you have is with guidance. What do I mean by that? What I mean by that is make sure that you consult a physician on the ground, or somebody that you have consulted before you get medications, because you may be in a situation where you may have access to the medication in Iraq without actually having the proper you know guidance on what type of medications and which medications you may need. Because again, people are being helpful, and some mawakibs are like that too. It's an open secret. So, you have to be careful. Just having access to medication is not always a good thing. Be careful with that. There are going to be mawakibs that are there not only on the route, but even when you arrive to Karbala, there'll be mawakibs, there'll be hospitals nearest to Imam Hussein and Hadl Abbas's shrine. There's the Al Safir Hospital, but this hospital is only going to take very specific emergency cases. However, they're going to be medical camps for less severe cases. Of course, they can stabilize emergencies as well, and we'll talk about that more in just a bit. And one of them is going to be, of course, the Imamia medical camp. We have first-class facilities, as you will see. There are other medical camps, and there are services such as, they call them mobile units here, is basically people with the stretchers. So if your loved one or if somebody needs, to be transported somewhere in a huge, massive Arbaeen crowd, you will see the people very clearly dressed in bright vests carrying stretchers, and they can put people on those stretchers and run with them in a safe way to the appropriate location, depending on the severity of the care that is required. They can take them to one of the medical camps, or they can take them to the hospitals if necessary. There are ambulances, of course, on the route as well. And those ambulances can transport you to various hospitals. Near the shrine, there is, of course, your Al Safir Hospital, like we mentioned. There are other hospitals in Karbala. There is Zain al Abidin Hospital, and hospitals like Zain al Abidin Hospital are, I mean, this is not an encouragement for folks to take advantage of it, but it's just for your awareness. It's, the cost is completely covered because it's sponsored by the Shrine of Imam Hussein. So let that not be a factor. All I'm saying is to get emergency treatment for yourself or your loved ones in Karbala. Things will be taken care of for you. Let's go on to Imamia specifically. Imamia was, we are proud to say Imamia was one of, if not the first medical camps in Karbala during Arbaeen after the downfall of Saddam. I mean, that is, incredible. You always wonder what was that first video on YouTube? You know, well, Imamia was one of the first medical camps, now, mashallah, there are thousands of medical camps. We are, and we will continue to be, inshallah, the standard setters. So Imamia Medical Camp till now has served, more than 750,000 patients. That's incredible. Imagine that. We have given away more than $750,000 worth of medications to the Zairine. And parallel with Imamia's incredible mission of service, their clinical service is also their training and education service, where Imamia has partnered with certified instructors to bring gold standard training and education to Karbala, because the saying that Imamia uses in its medical camps when it comes to clinical provision of care as well as to training is that if it is not good enough for US or UK or Canada, it is not good enough for Imam Hussein. So these are gold standard practices we bring despite the challenging environment, from the clinical care as well as the training and education of your BLS courses, ACLS, PASS, mass casualty management, incident command systems. And because we believe in promoting and sustaining a local growth, we don't just go there, pat ourselves on the back and come back. No, we are the ones that are sincere and dedicated and invested in the local community, because ultimately that community is the one that does end up taking care of the Zairine throughout the year. And Imamia is part of this sacred mission with the local partnerships. All right. Next. Oh, I just want to mention, some of the organizations that we are proud to be partnering with. This year, we are partnering with Imam Hussein's Shrine of Health and Medical Education Authority. In the past, sorry, can you go back one slide, please? In the past, we have partnered with Hadhr Abbas's Shrine, Imam Ali's Shrine, and we continue to have great relationship, by the way, with all of these. We have partnered with the Karbala Health Department and the governor of Karbala. We have partnered with DG Health of Karbala and Ataba Hussainiya Sehat and Taslimat. It shows you that Imamia we believe in a synergistic relationship. We don't believe that, it's your work or my work. No, we have a very core concept that this is our work. And so we help others, we partner with others, we take support, we give support, because ultimately it's about the patient who is the Zairine at the end of the day. And we lead these efforts. The Imamia Medics camps, like I said, they are the gold standard. They are the trendsetters. They are the 24/7 coverage during the time of Zairine. We have services that, quite frankly, are not really provided, anywhere else in Karbala, and probably not even in Iraq. For example, we have podiatry surgeons, special surgeons for your, foot care on site. doing procedures for the people who have walked. We have our dental surgeons, all levels of surgery, to the most complex, so maxillofacial to dental restoration to dental checkups. We have ophthalmologists, we have pediatrics, we have OB-GYN on-site, ortho, cardiologist. Dr. Jaffer himself is an interventional cardiologist. I mean, we have some of the world's best physicians and healthcare providers on site. Of course, we have emergency services. We are able to stabilize the patients, in the most critical cases. Sorry, can you just go back one more? I just want to make sure I cover everything that we need to. There's just a little example of the pace at which the Imamia Medical Camps works, the efficiency of it, and goes to the great work of the administrative staff that keeps this pace going. And that is, we have cared for more than 35 patients in 1 week. Imagine that, the rapid pace of the work that we're doing, which is why we emphasize, help us by helping yourself. Make sure you take your medications, bring them, make sure you're taking it easy when you need to, be responsible, hydrate, avoid heat as much as you can, and so on and so forth. All right, next. We have some fantastic diagnostic tools. One of the worst things you can imagine that could happen to your loved one is they could have a heart attack. In a situation like that, well, first you got to make sure that we get the appropriate diagnosis. So besides the ECG machines, one of the diagnostic tests to confirm that is your enzyme test of your troponin. So we actually have those machines on site. We have machines that can do blood work, get the basic lab work done on site. I mean, this is just revolutionary. But we are the trendsetters, so we make sure to have those in place. We have the ability to manage, the most critical as well as the most common emergencies. For example, the emergencies caused from heat exhaustion, as Dr. Jaffer had earlier mentioned. All right, next. All right, so Imamia Medics, when are we going to be on site? We will start operations from August 6th, going to approximately August 15th. Why approximately? Well, folks, remember, it depends on your lunar calendar. So as soon as you sight the moon, we sight the moon, we can tell you the exact time when we'll be ending. But if you're there, we're there. That's how it usually works. And we're there covering this service, like I said, 24/7. You can rely on Imamia Medics Camps under the health authority of Imam Hussein Shrine, in which we are partnering. And we have these incredible services, like I said, ophthalmology, dental, general, emergency care, OB-GYN, pediatrics, orthopedics, trauma. Hopefully it will never come to that, but we are well prepared for any sort of emergencies. And the medical campsite is going to be on your Sidra Street. It's right on Imam Hussein Shrine. If you Google map it, there's a street called Sidra Street. It is right on the Sidra Street, the Imamia Medics camp. It's a beautiful site, highly accessible. I think you're going to be able to find our service very effective and useful. And the language barrier, well, for Imamia Medics camps, there's no such thing. We have our own manifestations of Google Translate. We have real life folks that can speak all the languages you can imagine. They can speak Arabic, Farsi, Urdu, Hindi, Gujarati, Swahili, and the list goes on and on and on. The plus sign means it goes on and on. We have these people on site being able to speak and communicate on behalf of you and your loved ones and all the Zairines, so that critical information is not lost in translation during medical care. One small point I want to mention. Remember the amount that we spend on medications? Well, folks, money doesn't come out of thin air. We highly encourage you, ask you, kindly request you, please use the link that you see over there. that is posted to donate, if you can, towards this cause. Everything that we do, it is out of the goodness of our hearts. We don't make money off of this. We are doing it for the Zaideen. Please, please, please help us in our mission to serve others. Every little bit counts. We do a lot, I'll just take myself out of the equation. I've seen, Dr. Jaffer, for example, work shifts that I don't think, quite frankly, that he may be pulling those hours even at home. And he does it out of the love for the Zaire. And the center of care he brings, the exhaustion he goes through, is just absolutely incredible for me to see what he does. And so how do you support physicians like that? And he is an example of the entire staff of Imamia. So what can you do to be part of this incredible mission where you are the servants to the visitors of Imam Hussein? Well, you can do your part by donating. Every little bit counts. Believe me, it really does. Thank you. Next.
So thank you.
Well, thanks. I think that
Yeah.
concludes really the slides we had, I believe.
Yeah. So there are some questions in the chat box. If you can, both of the speakers respond on that.
Sure. So I think I've been trying to respond to some of them as they've come. If there are any questions anybody had, I mean, in view of the time, why don't you just unmute yourself and fire away?
Yes.
Assalamu alaikum.
Wa alaikum salam.
My name is Shakil, and I wanted to check with you if Jardiance is one of the diabetes medicine that causes lot of water and the salts.
So I missed the last little part of what you said there.
I take Jardiance, and does it cause loss of water and electrolytes?
It does act as a very mild diuretic as well. So yes, it has it contributes to fluid and electrolyte loss. So it's one of those drugs you do want to be a little careful about, but the effect is mild. The key is that it is one of those forces that is acting to further deplete you, and you need to be that much more aggressive about extra hydration. People may be fearful about overdoing the hydration because they don't want to end up with, congestive heart failure or volume overload. But the risk of that happening is, I think, quite low because your losses are that much higher.
Thank you.
Great. Any other questions?
There's a question about how to prevent pneumonia.
How to prevent pneumonia? Don't get infected. But you're in an environment where there's millions of people. You're in isolation, and social distancing is not a thing. It doesn't exist. It's not an option. And inshallah, it's a walk of faith. It's a journey of faith. And you will be exposed to pathogens. Of course, I think the nice thing is that for the most part, a lot of your exposure is in the open air. And so the open air itself has a wonderful effect of dissipating, pathogens. But, if you do have somebody in close quarters that, coughs or sneezes, and you're in that, couple of feet distance, and you're gonna, be exposed to the aerosol. So you will potentially get some risk of a exposure to a pneumonia pathogen, but you can protect yourself by wearing an N95 mask if you're that concerned when you're in very crowded, public environments such as inside the Haram or Bainul Haramain, for example. That is an option. But we in the mission, we did wear those N95 masks quite religiously back in the COVID years. But I got to tell you, it's quite tough to maintain those masks. They don't, by definition, they don't allow you to ventilate, and your mouth is one of the key ways in which you release heat, and wearing that mask obviously is a bit of a damper on that ability.
you. And being vaccinated ahead of time actually protects you from within. Your own body is fighting against any pneumonia, even if you're exposed. One of the things that was discussed over here was about the cooler to store the insulin. Dr. Jaffer has shared that link in the chat, and we'll shortly repost it. The next question is with regards to a 9-month-old baby who's going for Arbaeen. So any precaution there that you would like to share?
Well, the 9-month-old baby, of course, I mean, if you look at babies in general, their surface area to body weight ratio is huge compared to an adult. So they have a lot more exposed area relative to their blood volume to lose fluids. And so they need even more attention to hydration and nutrition than even an adult would. Their bodies, dehydrate very, very, very fast. I don't know if anybody's a gardener out there, but if you're planting pots or plants inside pots and the pot is very, very small, you'll find that in the summer heat that you have to water this pot like twice a day and it just keeps drying out. Well, that's kind of the analogy with a baby. And so you want to be very, very aggressive about keeping on top of them and looking at like their diapers to see, is their urine output or is their diaper completely dry?
Just adding to that, as a father of young kids, although they're not 9 months anymore, but boy, it feels like yesterday that they were. Milk, if you're feeding the baby yourself, hydrate yourself. Simple as that. If the baby needs formula, don't take it for granted that you're going to be able to have access to that here in Iraq. Make sure that you have a plan, you have the packets, you have the formula on hand, and powder is generally better because it's not going to spoil because of the extreme temperatures that we were discussing about earlier. So make sure you come well prepared and make sure you're able to feed the baby its milk intake and keep that at a healthy rate.
Excellent, thank you. The next question is with regards to chronic kidney disease. If anyone already suffers from chronic kidney disease, what precautions should they watch out for?
So chronic kidney disease is obviously the main issue tends to be where you have the inability to kind of process sodium load, and with sodium comes water. So in our normal environments, if somebody has CKD, chronic kidney disease, and you overload on sodium, like you have a very salty meal, you had, biryani and some fried food and whatnot, you're going to get overloaded with volume. And if you had normal kidney function, you would easily urinate out the sodium and the water would go with it. But in people with CKD, there is that impairment of that ability to do that. But here in this environment, what we're talking about is that this is a place where you're going to be losing a lot of sodium and electrolytes through the skin. And so the risk of your CKD actually getting worse, it's not that the CKD will get any worse, but you will add what's called acute kidney injury on top of the CKD, which is simply due to dehydration and volume depletion. And so you do run the risk of worsening your creatinine, for example, because of that loss of blood volume and loss of that blood perfusion pressure to the kidneys. That's all reversible. It's something that will fluctuate with your volume status. So again, you want to do everybody, no matter what their condition. I guess one of the take-home messages is that in this environment, everybody needs to hydrate more than what they do at home. More water and a little bit more electrolytes. But of course, if you have CKD, you don't want to go overboard with the sodium loading. So you do have to be a bit careful about, the ORS tablets, because sometimes if your, concentration of the ORS tablets or the ORS powder inside your liter of water, if it's too high, then what you're actually drinking is hypertonic, not isotonic. And that means that you're getting too much sodium for what you need compared to your water needs. So it's kind of hard to explain that, but you just want to maintain, as close to normal concentrations of water and sodium in your bloodstream.
Mr. Sadiq Mukhi has a question. Go ahead, please.
Yeah, I just want to know that whether taking shower makes any significance in extreme hot temperature and all, and how frequent.
Maybe you want to tackle that one?
Yeah, I mean, look, it's a way to cool off, but nothing can substitute for actually drinking water. On that note, make sure if you're coming, look, we are a little bit fragile and frankly quite spoiled living in the West. So if you are from places like UK, US, Canada, you're used to being careless with whether or not water goes inside your mouth and you ingest it. In Iraq, if you're arriving, do not do that. Make sure you're careful about that. But nothing, as Dr. Jaffer has already spoken at length, and we have also covered that. Nothing can substitute for actually drinking clean water for yourself. Shower can help. It's good for your hygiene. It can prevent infections. Sure, it helps you cool you down a little bit, but nothing can substitute for actually drinking water for hydration. Thank you.
Perfect. And I would like to highlight over here, Dr. Jaffer has been answering questions in the chat box for majority of the people. The next question is from Sana. Sana, go ahead, please.
Assalamu alaikum, team IMI, great workshop, great meeting right now going on. May Allah bless you in both the worlds, alhamdulillah. My question is with Brother Mehdi. During the Arbaeen walk from Najaf to Karbala, maybe I think I have joined a little bit late in this meeting. I wanted to know what is the role of IMI team during the walk in Muakib. They are helping out in some way during the walk. My focus is on the walk right now.
Yes, that's a good question. I think that sounds like somebody I know. First of all, our focus is in Karbala because we go where the angels go. That's our motto. So that's why we are there in Karbala. That's our biggest footprint. However, if you coordinate with the Imamia crew, IMI crew beforehand, we can certainly help advise. We can help even coordinate, a certain care aspects. And we consider this not their effort, our effort. This is all one effort to serve Imam Hussein. So you're welcome to coordinate with the Imamia team. In fact, since I know this very special person, I will reach out myself and we can figure that out. Thank you.
And Sakina Rizvi is also would like to share a comment.
Yes, welcome everyone. I'm Sakina Rizvi. I have been working, coordinating the annual Arbaeen medical mission for many years from headquarters along with Dr. Qasim Jafri. For Sana, just to respond to your question, the international team, our work is primarily in Karbala at the camps close to the Haram over the years. Along the walk, we do have certain mokibs that have over time reached out to IMI and our different chapters around the world for assistance or recommendations and to help them source doctors. So we do have, different sort of levels of familiarity and connections. And I think as Dr. Mehdi mentioned, we can help share some of those resources if people are interested as well.
Excellent. Any other question? I don't see any in the chat. I believe our speakers have done a supreme job, like covering a very big topic. And I hope all the pilgrims reach their destiny and like pray for us as well. Please, there are links over here in the chat. If you want the recording, please make sure you sign up so that we can actually share this recording with you, and you can share it further with your relatives. There are also links to the maps where the IMI camps are. And then in addition to that, there is, on our website, you will find the place where you can help contribute. If you're not going there personally, you can actually help all the pilgrims keep up with their medicines and provide them emergency care. So with that, thank you so much, and may Allah bless every one of you. Thank you. Allah Hafiz.
Thank you.
Thank you so much, Dr. Kiran. I would like to pay thanks to both of the speakers for a very brief and insightful session on Arbaeen and health. And once again, thank you, Sister Sakina Rizvi, for all the preparations, Dr. Kiran for moderation, and Dr. Kayumi for assistance. For the audience, thank you so much for attending patiently, and requested to stay tuned for the recording of this session and the newswire, upcoming newswire for this topic, Arbaeen and health. Thank you so much.